two. We can do two. Hello and welcome to the Skin Cancer Awareness Project online training platform. My name is Breelyn Van Leeuwen. I'm a physician assistant and the lead researcher on the SCAN grant. We're so glad to have you here. The SCAN mission statement is really to raise awareness of skin cancer, but to have all of you out there watching be able to have confidence to refer your clients to a skin care professional, a dermatology provider, and make sure that whatever you find isn't at risk for turning into cancer or isn't already cancer itself. You can read our mission statement in detail here, but in a nutshell, that's what we're hoping from you, is that we can feed you the confidence you need to make a referral of your clients to a dermatology provider. Here are a few statistics. Skin cancer is the most common cancer in the United States. That probably surprises a lot of you out there, as it did me when I first heard it. So the skin is the largest organ of your body, and it's important that we recognize how prevalent skin cancer is in the United States. 2 people die of skin cancer every hour in the United States. Ultraviolet radiation, or the sun, is what causes a lot of these skin cancers. So preventing the UV damage that you can get from the sun is something we'll talk about a little bit more in detail here. When detected early on, the 5-year survival rate for somebody diagnosed with melanoma, which is the most dangerous form of skin cancer, which we'll talk about later in the slide, is 99%. So early intervention is so key into the survival rate of our patients. Here's another fact. By the age of 70, 1 in 5 people will be diagnosed with skin cancer. That's a lot. Family history of melanoma also increases your risk of getting melanoma, so that's a really interesting fact for you, for your family, for your friends, for your clients. Now, out there in your guys' industry, your main job is to make us feel more beautiful, help our skin feel great, help our hair look good, give us a little bit of confidence walking out the door. And on our end, we want to give you the confidence to refer your clients to somebody like a skin dermatology provider. And the most important takeaway I want you guys to remember is you have a very, very unique position where you are seeing someone's skin and scalp in detail up close on a regular basis. Hardly anyone else is going to do that for your clients. In some cases, it's very frequent. You guys have an opportunity to see something, say something, get them to a dermatology provider early, as we know that early intervention is very important for treatment. Everybody is at risk for developing skin cancer. The old, the young, the dark skin, light skin, men, women, we're all at risk for developing skin cancer. If you have skin, you can have skin cancer. Skin anatomy, a little bit here about skin anatomy. Skin anatomy is something that we're not going to go deep into, but we'll talk about the 3 main types of skin cancer that can happen in your skin: basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell is the most common type of skin cancer. Melanoma we're going to talk about more because it's the most dangerous form of skin cancer, and the most dangerous form of melanoma is actually found on the head and scalp. Here are some pictures of those 3 types of skin cancer we talked about. Melanoma is here on the left-hand side of your screen, and it tends to have the most pigment, be the most colorful, and sometimes the most alarming when you see it. In the middle, basal cell, these tend to be a little bumpy, waxy, and a wound that won't heal. So if you have a client that comes in and says, oh, I've had this mark on me for a long time, it hasn't gone away for weeks, for months, that's a red flag. That's something that should be seen. Squamous cell is the last picture, and that tends to look a little bit more like a scab. You'll see this oftentimes on people that they'll be picking at it, and it's a scab that's been there for quite some time. That needs to be seen. So we're not asking you to turn into dermatology providers overnight and be able to differentiate between these 3, but keep your eye out for any kind of skin lesion. Also, lesion is known as just a mark on the skin, something unusual that shouldn't be there. Knowledge is power. So again, the majority of melanoma cases are attributed to the sun, to UV exposure, to exposing your skin inappropriately to UV rays. Experiencing 5 or more blistering sunburns between the ages of 15 and 20 increases your risk of melanoma by 80%. That's huge. 80%. Another really big factor on here is that you can talk with your clients about are the dangers of tanning in tanning beds. Especially when you're younger and an earlier age, the risk is higher, but exposing yourself to a tanning bed, it increases your risk of melanoma significantly. Prevention is key. Please use a sunscreen every day. This is, as estheticians, I'm sure you'll be talking with your clients about sunscreen on a very regular basis. And it should be a broad spectrum, so it covers UVA, UVB, but it should be SPF 30 or higher and reapplied throughout the day. That's a very important aspect of this too. Another big trend that is becoming more popular is using UPF protective clothing. It's becoming cool to wear a long sleeve swimming suit for women, which is awesome, and some other big changes in sun protection in clothing. Hats that have a wide brim are an awesome thing for you to do. They say 3 inches or larger on the brim size. Avoiding the sun between the hours of 10 a.m. and 2 p.m. are great. So these are some good things you can teach your clients and also implement in yourselves and in your family and friends. I'm going to now turn the time over to Mark Hyde, who is actually one of the founding members of the SCAN Grant.
Thanks, Bree. I'm excited to be here and talk a little bit about skin cancer. As she said, my name is Mark Hyde. I practiced for 15 years as a physician assistant treating skin cancers, but focusing mostly on melanoma. And then after that, I earned a doctorate degree in public health focusing on melanoma risk factors. And I currently work in a melanoma laboratory. So I spent all of my career in and around the melanoma space. And I'm excited to share some of that knowledge with you. So we're going to talk a little bit about how we look at skin lesions. And again, Bree already told you that lesions are just moles or spots. We say lesions for anything we see on the skin. It's a generic term that allows us to call anything on the skin a lesion. So when we look at skin lesions, we want to be able to decide which ones are problems and which ones aren't. The most common public health emphasis is through the ABCDE criteria that we're looking at on the screen now. So the first is asymmetry. That means that the lesion is different on one half than the other. So it's perfectly round on one side and then it's jagged on the other. That would be an asymmetric lesion. The second is a border irregularity. So border irregularities mean that there's something sticking off the lesion, or there's a normally round lesion then with a big projection out into the other areas of the skin. Color irregularities. So if you have more than one color, that's not normal. Most skin lesions are a single color. Diameter, anything bigger than a pencil eraser or your fingernail on your pinky, it's getting that size, it should be evaluated. A lot of them are benign still, but they should be evaluated. And then evolution, this one's hard because we can't see it in a single setting. We can't see it once, when we see a client the first time. But as we see people over time, if something's changing, that's an important indicator that it's not okay. Another public health message that gets pushed a lot is the ugly duckling method of looking at skin lesions, and I like this one a lot because for me, when I was seeing patients, this is the more important way for me to identify which lesions were problematic. So when you look at the pictures that we're looking at right now, on the top row there's 3 pictures of pigmented lesions, 3 moles, and if you just look at those alone, you could argue with yourself about whether they look abnormal, A, B, C, D, E, that violate some of them but not all of them, So you could say, yeah, those are problems. And honestly, if you just saw that, I would say hopefully you're sending that to a dermatology provider. But if you look at the pictures on the bottom, what you'll see is that patients, when we see them in clinic, might have hundreds of lesions that look all the same. And then if you have 100 lesions that violate the ABCDE criteria, that means that they're probably not a problem. But if you have one that's different than all those 100, that's the one we're going to focus on. So when you're looking at your client's scalp, if they have a whole bunch of spots, bumps, lesions on their scalp, and one of them is very different, that's concerning, and you should refer that person to a dermatology professional. Even after 15 years of screening patients for skin cancer, it was very difficult clinically to be confident that I knew which ones were cancer and which ones weren't. And this row of pictures, the 2 rows of pictures, demonstrate how this can be difficult. So the top row are all cancers, and the bottom row are not. So when you look at this, it's pretty hard to say why one on the top is different than the one on the bottom. And clinically, that's true as well. As a dermatology professional, I have other things at my disposal to test these. I can do genomic testing, biopsy. I can look at it under a microscope. I can call in a colleague to look at it as well. So your job will not be to try to decide if it's a problem or not. Your job is simply to decide if it needs to be seen. And most of the time, if you see a spot and it catches your attention, the answer is that it needs to be seen. So we're going to do a little demonstration with this one on the ABCDE criteria. So you can look at any one of these, and on your own time, you should look through all of them and try to use the ABCDE criteria to evaluate each of them. But I'm going to focus on the one in the middle on the bottom. When you look at that lesion, if we draw a line right through the middle of that lesion in the middle on the bottom, is it asymmetric? I would say that when you draw that line through, depending on where you draw it, it's probably not that different. It's very similar. It's jagged edges on with black color around a clear center all the way around. So it's not asymmetric. Does that mean it's okay? Well, let's go to the next one, the border. The border is very jagged and irregular. That's not a normal border. So I'd say that violates the border criteria. And then color, is it more than one color? Most certainly. It's easy to see that it's more than one color. So already we've violated 2 of the 3 ABCDE criteria. Diameter, we don't know in person. If you saw this, you could sort of check it against a fingernail or an eraser. You can eyeball it and see if it's big. If it's big, then it would violate that one. And then evolution, if you know this person, it's a client, and you're seeing that change over time, you can evaluate that. Regardless, how many criteria need to be violated before you would say it's irregular? It's 1. If you see something irregular, then that should be seen by a professional. This one already has 2, and maybe 3 or 4 depending on those other 2. So this is evolution. We want to demonstrate evolution a little bit more because evolution is really important. Even if a spot looks okay, it's round, it's got one color, the borders are normal, but over time it's changing. As you can see the example on the right here, that dark spot on the right, it's pretty normal border, it's all one color, there's some irregularity, but over the course of a few weeks it's almost doubled in size. That's evolution. That's a criteria that's been violated, and that's most certainly should be seen. The one in the upper left, you can see over time that's growing bigger and getting some, those 2 colors are becoming more pronounced, so also evolution. If you're seeing your clients regularly and they have a spot that's changing like this, that's a reason to send them in and have that checked. Over the course of my career, I had a lot of patients come in that were referred to me by hair professionals or others in the service industries, and they would come in with these spots that I probably wouldn't have seen otherwise, and we ended up diagnosing and treating cancers. This picture is a picture of our founder who went and had his haircut, and during the haircut it was mentioned that he had a spot on his scalp. We don't have a picture of that original spot, but what you're seeing is a picture of the hole in his head that was carved to remove the melanoma that was found as a result and saved his life. He has a scar, as you can see, and I like that he put the glasses in there. You can get an idea of how big that hole is. And it was closed and healed nicely, and he has a scar, but he's much happier with the scar than with active melanoma. So last thing I'll say is that visual perception is not the only thing we use. Early squamous cell carcinoma and basal cell carcinoma are usually texture only. If you get a sandpaper feeling or you get a really smooth, marbly texture to the skin, those texture differences can also be harbingers of cancer. So even those simple things that you see that you think, well, that's not a spot, or it's not brown, or it's not a lesion. If it's something unique, it feels different, it looks different, just refer it and have the healthcare professional determine what is going on. So thank you for listening to this portion. I'm going to turn the time back over to Bree.
Mark, thank you so much. So what is the role you play here? The role you play here is to say something. If you see something, say something. Use the knowledge you were just given by Mark to identify a suspicious mark on somebody's skin or hair and say something to your client. Don't be afraid. Don't let that fear of being wrong prevent you from saying something to your client. On my way over here on the drive, I called my grandma, who's been a hairdresser for 40 years, and she said that in her time as a hairdresser, she knows of 3 specific times where she referred a client and they were diagnosed with melanoma. So she has saved the life of 3 people. Think about all of the people that she probably helped and referred that she didn't get any follow-up on, but you could save a life. That's the reality of this moment, which is so cool. And we've had people take this course and we've heard really great successful stories after that, and it helps us continue to teach hair professionals and skin professionals like yourself, because you can save a life. It's very great. And the worst case scenario is you refer a client for a mark on their skin that you think looks abnormal. They go see their dermatology provider. They were told it was fine and benign, which means that it wasn't cancerous. That's the worst case scenario. But the truth is, we should all be seeing a dermatology provider at least every 2 years, if not yearly. So you're probably not suggesting that your client should do something that they're already recommended to go and do, is to see a dermatology provider. And again, we're not asking you to diagnose anything, so please don't tell your client they have skin cancer. Don't frame it that way. And if we want to practice saying these things to our clients, there's a couple of really great videos on our website that you can go to, and you can watch an interaction happening of how the hairdresser or a skin professional actually tells the client of a mark that they found. So if you need some examples, please go and watch those videos online. To review, we want to, number one, let your client know about a lesion and show them the location. That's very important that they are shown the location. Step number two, tell your client to visit a medical provider or a dermatology provider. Step number three, give them a handout card, which we will provide for you for free again on our website, and mark the spot that you have found on their head or scalp. Oftentimes, they will not remember the location, and then that can be missed when they go into their healthcare provider. So marking it on a card is extremely helpful for them. And again, that resource is free for you online. And a bonus point, if you can give them an actual phone number, if there's a dermatology provider in your area that you know your family and friends like, that you like, that is well known, or somebody that you feel confident in, please provide them with that phone number, because they're more likely to call if they have a phone number easily accessible to them. Practice makes improvement. So this is the point in the video where we'd like you to pause and take a time out and practice actually telling a client, a fake client, that they have a suspicious lesion on their head or scalp, and maybe some aspects of the ABCD that you see that could maybe look like something they need to go get checked out. On the bottom right is an example of a graphic from the website that you can print out. You can mark on the head, on the scalp. You can even put the date, that's very important too, so they can take that to their healthcare provider. So if you can hit pause in your video now and practice either using graphic 1 or 2 or both, and tell your client that you have found something on their head or scalp. We want to thank you so much for taking the time out of your busy, busy lives to do this training. Your clients will thank you. We thank you, and we're so grateful that you were here.